I'm Lieutenant Colonel Shashikala. I served Indian Army for 14 years, and from 2015, I've been into healthcare training, but not as a formal training. But I was taken into this field with the introduction because, as ma'am mentioned in the beginning, there are very less trainers who are actually doing these things. So I got some couple of projects with the hospitals where I started doing this work, and I am here with a small company called as AMTS, Academy of Medical Training and Services, which I am a proprietor of, and I do freelancing. And because I did my general management course with IIM Lucknow, that has given me little diverse experience of communicating more, team building, problem solving, and things like that into my healthcare. So I am looking forward specifically to understand what are the gaps I have when I am teaching, and how do I get knowledge of you to fulfill that gaps. Thank you very much, ma'am, and I'm looking forward for it.
Thank you. So whom do you want to pass the baton?
Yeah, next is Deepthi, I could see next to my name. So,
sure.
Deepthi.
Yes, Dr. Deepthi, please go ahead.
Yeah, I am Dr. Deepthi Goswami. I have been teaching at Maulana Azad Medical College, New Delhi for past 21 years. And I had a good fortune of getting to know Dr. Indu Anuja about in 2015 or 16 when I was a co-faculty with her at some healthcare communication courses held at my institute. And that kind of gave me insight upon this very important aspect of medical education, which is totally neglected. It's just not addressed. Imagine we spend our whole time communicating with patients with no guidance, no template, and we just go as hunch, thinking it is just a communication skill, just like we talk to our friends or family members. But with so many health, issues related to interaction between patient and doctor cropping up, and I've seen.
Dr. Deepthi, I think we lost your voice in between. There is some challenge with the audio. I think that's one of the challenge with Zoom programs. And we lose. Really sorry, Dr. Deepthi, we could not hear you because of the network issue, I believe. And we missed a part of your introduction. So if I may request somebody else to start the introduction, because Dr. Deepthi might log in and log out and log in. So can I request Dr. Ela to give her introduction?
Hi, good evening. Good evening, everyone.
Very good evening.
So I am Dr. Ela Ghosh. I have done my graduation in homeopathy. I am a homeopathic physician. And then I have done my MBAs and administration courses. Now, currently, I am working in a multi-speciality hospital in Mumbai, which is a 200-bedded hospital. It's been last now more than 17 years in this hospital. Overall, I have an experience of 20 plus years. Basically, my intention of joining this program is to, I am myself actually in this current organization where I'm working, I'm a trainer myself. And I've been taking training for postgraduate consultants and doctors. And my interest area is communication. So currently I'm pursuing my PhD also. And with this regard, I want to master myself in this particular topic. So because I am taking the training, but I need to learn myself and impart the same to my colleagues and professionals, seniors and juniors.
Wonderful. Thank you so much, Dr. Ela, for introducing yourself. So, Dr. Deepthi, if you are back and if you would like to complete your introduction, or you want to first settle down and we come back to you.
Yeah, I regret the interruption, something wrong with my connection there, so I shifted my position. Well, I was just saying that this communication course is going to be more of a life skill for me, I feel. And I intend to take it back to my department, my residents, and see how that makes a difference to, at least generation of residents that are going to work with me. And I would definitely like to train them and see if we can make a difference in what.
So friends, Professor Dipti is a very learned and experienced gynecologist and obstetrician at Maulana Azad Medical College and LNJP Hospital. So I had the good fortune of being with her for almost like 10 years. And we have conducted almost like 100 programs for the final year students of Maulana Azad Medical College. That's something like mandatory. The students have to attend 1 day program with us before they start with their internship. So we have designed and customized the whole program to meet their requirement and prepare them for the patient interaction point of view. From the patient interaction point of view, it's a very interesting program, full day program it is. So we get students in the batch of 30-35 and we give them full day training with a lot of role plays and activities. And that's after that they are allowed to go and work in the clinical setup. And she's very keen learner, and I really thank her for sparing her time to be here with all of us. That shows her her interest in the program and subject. Somebody's audio is on. If I can request you to put on the mute mode. Dr. Gaurang, I think it's yours. Okay. So, Dr. Ila, thank you so much for your introduction. Whom would you like to pass the baton?
Ritika.
Okay. Ritika, go ahead, please.
Good evening, all of you. I'm a psychologist working at Sir H. Reliance Foundation Hospital in Bombay. I have done my master's in clinical psychology, and after that I have worked at Fortis, and now I'm working with H. Reliance. I work primarily in the ICU, and I come across very agitated patients, and I know they are going through their own set of emotions and a roller coaster of emotions. And what I want to do is learn what I can do to help them better and help them go through their grief better. And if they're agitated, do what I can to help them feel slightly better than they're already feeling, and at least help them feel heard. So that's my main takeaway. That's what I'm aiming to learn from this session.
Ritika, thank you so much for introducing yourself, and I assure you a lot of focus is going to be on how do you go about handling patients who are aggressive or non-cooperative, or they are emotionally overwhelmed, and how do you really proactively make sure that you can handle those emotions and also create peace and happiness between you and the patient. So it's going to be a program purely focused on this aspect of patient management. So you'll be happy about this thing. So whom do you want to pass the baton? Whom do you want to ask?
To Banureka, ma'am.
Okay.
So hi, ma'am. So good evening to all. So I'm so happy to be part of this program. I'm Ms. Banureka. I'm from a nursing profession, and I've done my graduation in nursing, and I have 22 years of good experience in clinical and teaching field. And since 14 years, I have been working as a trainer, and past 2 years, I've been working as a nurse educator in present organization, that is One Life Home Healthcare. And my company has given me this opportunity and identified the right responsibility to train me as a soft skill trainer. So in turn, I'll be teaching my trainee students, that is the nursing students, who are going to handle an aggressive, agitated, as she said, it could be an uncooperative patients, to how to handle them and how to manage them, how to start up the communication and on, and how to improve their etiquettes and all those skills I need to learn, and I'm going to train them in turn. So that's going to be my takeaway from this program.
Wonderful, Banureka. Thank you so much for your introduction. And I assure you, all these objectives will be very well taken care of during the program, and much more than that, much more than that. That's my promise to you.
Thank you.
Yeah. So whom do you want to pass the baton to introduce?
Could be Namrata Verma.
Yes, Namrata, please go ahead.
Yeah, thank you. Thank you. Good evening, everyone. Thank you, ma'am. So I would like to introduce myself. I'm Namrata Verma. I'm a healthcare management professional, and I'm into healthcare administration working from last 11 years. So my experience are basically more into hospital operations, where dealing with patients, that's a non-medical part of it. Like all the interactions with the OPD, IPD, and the other interactions. So yes, when I went through this program, I went through the details of this program. I felt that yes, this would actually help me for both professional and personal growth, the knowledge enhancement, everything, and it will enable me to deal with all the kinds of situations in professional field also, dealing with the different patients, handling them in a difficult scenarios. So yes, and then also I have in mind of training my team for the same thing, because in a non-medical aspect also we need to deal with patients in a more empathetic way, and there should be a certain way in which they should be dealt. So that is what I'm going to learn and take away from this training session. Thank you.
Definitely, Namrata. Thank you so much. Thank you for introducing yourself. So, whom would you like to pass the baton? Just before that, Ramaya, if I may request you to rename your login ID because it's showing heel mark. So it will be a good idea if you could, rename yourself and write your name so that we all know that we are interacting with Ramya and not heel mark. Thank you. So, Namrata.
Sure.
So, Namrata, whom do you want to pass the baton? So somebody's
it will be Pooja Swaroop Saxena.
Yeah.
Thank you, Namrata. Hi, Indu ma'am. Hello, everyone.
Just 1 second, if I may correct. There is a login ID from Training One Life. Who is this person? I want to know.
That is Dr. Ramya. She's my colleague. I think she's out somewhere.
No, her ID is heel mark.
No, ma'am. She's Training One Life is Dr. Ramya.
Then who is heel mark? I'm going to remove the heel mark then. Please identify.
I don't know.
Dr. Monica this side, ma'am.
Oh,
good evening.
Dr. Monica, please have your ID. And also, I'm so sorry. Actually, we are meeting for the first time face to face. So maybe I'm really sorry. Heel mark. Okay, heel mark is Dr. Monica. Dr. Monica, can you recorrect your login ID with your proper name?
I'll do that.
Yeah, thank you. Yeah. So sorry, Namrata, you have asked Pooja to introduce herself. Pooja, if you may please go ahead.
Yes. So again, hi everyone. I'm Pooja Swaroop Saxena. I'm based in Chennai right now. I belong to the medtech community. I am from a medical devices company, and overall around 12 years of experience. Training part, as far as is concerned, around 7+ years I've been into training. The training here was on another site, which was for the medical sales professionals. But during the interaction, we are doing lots of training programs for the nurses and for the doctors also. So during one of such interactions, all those trainings are clinical trainings, as in the in-service programs or therapy trainings and all. So during one of such interactions, when I came to Chennai, I belong to Delhi, but due to some personal reasons, settled down in Chennai. So almost 6 years back. So during one of the interactions, one of the nursing leaders in a very good, prestigious hospital here in Chennai, she was just asking, what and all is your profile covers as a trainer? So I just talked about all these aspects in the training, the communication, everything that we take care of. So she was just suggested, can you take some communication training for the nurses also? That was my first interface with the communication part. And then it was quite a curious thing for me also. So I kept on learning a lot on that. And it's been 4 years since that. So currently I'm pursuing a PG diploma course in training and development from Indian Society of Training and Management, ISTD there in Delhi. So it's the final semester, and healthcare communication is my key area of interest. So it's a curious thing for me to know inside what exactly things which are required to enhance this particular skill. So that is what I'm here for about.
So don't worry, Pooja. I think after this program, your training scope and content and delivery is going to be very, very specific now, and you will know what I need to cover with the nurses and doctors and any healthcare, professional for that matter. So thank you so much for being here. So whom do you want to pass the baton?
Dr. Virendra is there. Dr. Virendra, sorry.
Yeah, Dr. Virendra, please go ahead. Yeah. Dr. Virendra, please unmute your device.
Hello and namaste, everybody. Am I audible, ma'am, and to all now?
Yes, you are audible. Thank you. Yeah.
I thank for the opportunity to introduce myself. First of all, I'm Dr. Virendra. I am a medical director at one of the hospitals in Ranchi. I come with a body of 15 years experience, transcending from a medical officer to clinical administrator to operations to now director. So I have grown in the line, and I can perfectly understand the challenges that we face. I can just recollect, and something that has come now 15 years down in my career is something I would like to really look up to and listen in a structured way. Basically, I am a doctor and a qualified healthcare administrator, specialized in medical laws and ethics as well, from Bangalore National Law School. I'm also an assessor at CII for performance healthcare excellence based on Malcolm Baldrige criteria, and also European Foundation for Quality, EFQ. And I have a deep interest in corporate governance and sustainability, and so have undergone some trainings as for corporate directorship role as well. I do advise a couple of colleagues who have some ventures and try to understand, ramify myself, and try to just ensure that communication is on, not only in the hospital as well as in the society. I'll cut short, and I will just say that my idea of coming into the program was, I was really fascinated by something so niche as this, because I used to go through and hear about training programs, which are an overall aspect, which cover leadership, they cover coaching, but something specific and niche for healthcare and for doctors and say allied professionals is something really wonderful to look up to. And a lot of learning is something I'm looking at. And, I will rewind my 15 years and think how I would have addressed certain problems,
Sure.
had I gone through and I met. So that's it. I'm thoroughly excited, and thank you for the opportunity to introduce myself.
Thank you so much, Dr. Birendra. I think having people like you and many others in the program actually raises the level of the program, because I mean, you come with a lot of experience and expertise, and that's going to really benefit one and all. And having a mixed group is a wonderful idea, because then you get to see things from others' perspective. You will never get a chance to talk to people from training or from nursing or from psychology, the way we are going to interact here in a very, very neutral and objective manner. And that will give us the, insight into, the challenges each one of us are facing in our, personal and professional life. Plus, I assure you, this program is going to be actually niche, because you will find a lot of topics dealt in a very different way than what you all have been dealing with or teaching or training, because I have customized the program with the learning that I've had by conducting around 2000 programs by now. I'm writing to 1500 because 1500 after that I stopped updating, but I think by now it must have been 2000 programs that I have done. So that's the amalgamation, and that's what I bring it to this forum, and you will actually find it very different from regular programs, which I'll be introducing you in a bit. But I've seen your CV and it's very impressive, and it gives me a lot of satisfaction that okay, if people like you and all others are valuing my program, then it has to be something, and I have to excel at it. Thank you once again. So whom would you like to pass the baton to introduce? Sorry, I muted this thing. Please unmute your device, because there was a voice on your ear.
First of all, I thank you for your kind words and the encouragement. And I would like to pass on, I think Miss Pooja just entered the group after me. So let me pass on.
Pooja has done. It's Monica is left, and Dr. Gaurang is left. We'll have to ask him to, introduce. Who else is left?
I think the rest have spoken.
Yeah, we'll ask Dr. Monica first, and then Gaurang.
Yeah, sure. Yeah. Dr. Monica.
Dr. Monica, please go ahead. Yeah.
So, hello everyone. Myself, Dr. Monica Sabharwal, and currently I'm based in Chandigarh, Punjab. So I'm a dental professional, and after my graduation, I did my MBA in healthcare from Manipal. So initially, I started off with my practice, like I started my own clinic, and then once I completed my MBA, then I joined a hospital as a quality manager, like NABH, NABL coordinator. So there I realized that, this is a very, interesting field where you get to communicate with nurses, doctors, technicians, all sorts of healthcare professionals who are contributing actually to the care of the patient. Rather than the doctors, there was more, doctor role of the nurses and the technicians. And I was more engaged in training those people. And I myself took NABH training program for like, I think 2 months ka program hota tha us time pe, where we used to have weekend classes. This is in 2011 or 12. So that is how, my journey of training in healthcare started. And then I started giving trainings myself. So for last 5-6 years, I've been to healthcare trainings. And in 2019, we started off our own firm by the name of Healmark. And then it was our bad luck. Then, Corona hit us. And then we were initially doing few offline programs we did for 2 years. And then we had to switch on to the online mode as everybody else is doing. So now my aim with this program is that, I have this strategic thinking and planning wherein I have these courses designed according to the audience of mine and the people we are dealing with actually. Because as of now, we have to source our resources like trainers from Delhi and other parts of the country. I myself do trainings, but utna streamline nahi ho pata courses because I'm not a very professionally qualified trainer. So my aim is only to, have that strategic planning and, how to go about creating modules and what things we have to, keep in mind while delivering our trainings. So thank you so much. And I really look forward to this course.
Thank you, Dr. Monica. And let me assure you, this program is not just going to cover the content that you need to, include when you are planning trainings for the doctors, nurses, or allied healthcare professionals, but a lot of focus is going to be on the delivery of the content, because all of you may have wonderful clinical experience or knowledge or idea what to give, but then how to give that, how to engage your audience, how to design a successful program, how do you really facilitate an impactful program. That is something that we normally look forward, but we don't get to. But I have customized the program and integrated it in such a manner that you are definitely going to go back with a lot of, confidence that I can design my program, I can facilitate an, impactful program. And I, having been done my facilitation program with Dale Carnegie, I'm a trained trainer by Dale Carnegie Institute. So I, in spite of having so many years of experience, I did it to know what is the contemporary way of, conducting a program. And all that knowledge and learning I'm bringing to this program, and I've integrated in the program. You will get to see when I share the outline of the program with you. And trust me, you will also know how do you go about designing a program, even how to pitch your program and how do you go about, talking about it. We are going to cover even that part. Thank you. Thank you for being here. I think Dr. Gaurang is left. Dr. Gaurang, are you comfortable? And
yeah, ma'am.
Dr. Ramya, yeah. Dr. Ramya, two people. I think I'm not yet. Dr. Ramya, are you there?
Yes, doctor, I'm there.
So, Dr. Ramya, can you have your camera on, or it's difficult?
Actually, ma'am, I'm traveling, so it's very difficult, but definitely in the coming and future classes, we'll have an interactive session. So sorry
Dr.
for
Ramya, are you going to be in travel for the full program for 2 hours, or anytime towards the end, you're likely to reach a place where you can have your camera on?
Yes, yes, I can make the camera on after some time.
Okay, so whenever you are ready, we will pause for a minute and have your introduction. That's perfectly all right. So you be comfortable and just attend the program, but you must introduce. That will be really good. Okay, my next question is to Dr. Gaurang. Are you in position to have your camera on?
Yes, ma'am. May I?
Sure, please go ahead.
Yeah, I've just taken some time. I'm so sorry that. So first of all, very good evening to one and all. So I'm Dr. Gaurang Narayan. So I'm a fresh MBBS graduate who passed from Indira Gandhi Government Medical College and Hospital, Pondicherry. I'm currently working as a consultant medical editor and an associate lead for Neuroglia Health Private Limited. It's called Marrow. So it's actually an edutech platform which actually trains MBBS students for the postgraduate entrance exam. So I work as an associate consultant editor and the associate team lead. I've also finished my postgraduate diploma from Medical Law and Medical Ethics from National Law School, Bangalore. And my subject of interest is obstetrics and gynecology. I aspire to be an obstetrician and gynecologist, a cosmetic gynecologist to be specific. I finished my step 1 of MRCOG. So basically, I'm taking up this course because I believe that healthcare communication is one of those fundamentals area which is important for building an effective doctor-patient relationship. And as an upcoming surgeon, as an upcoming gynec surgeon, and especially considering the gender bias that's prevalent in the society, I feel that for effective doctor-patient relationship and trust issues to be solved, you need effective communication. So I've been closely following you in LinkedIn. I've gone through your recent publication on healthcare communication, and I've been a part of my student council during my UG days. So when I see the paradigm shift from the 2019, that's the introduction of CBME curriculum, I feel that I've missed on quite a lot of few things in my undergraduate days.
Yeah.
So I look forward to, I take this opportunity and I'm considering this platform to build on my communication skills. And most importantly, also, having said that I come from a law background as well, I also strongly believe that if communication is strengthened between the doctor and the patient, a lot of medical legal litigations can be solved. If the patient trusts you, definitely you can cut down on the litigations that you might face. So as an upcoming surgeon, as a very young surgeon, I believe this is important to me, and I look forward to interacting with you all, knowing you all in person. Thank you so much for this opportunity. I'm sorry, today is my parents' 25th wedding anniversary, so I had to sneak out. So please pardon me.
Wow. So congratulate them from our side, but that's perfectly all right.
Thank you so much.
So, yeah,
Thank
please
you so
congratulate from our side. That's all right. If you want to keep your camera off, you can do so, but at least be on the listening mode. That will be really nice.
Yeah, that's there. Thank you so much.
I don't want you to miss the actually any session, because every session has its own learning objectives and a purpose. Like I've not included any topic just for the sake of including, but every topic has a purpose, and you will see it when you will, go with us on the journey. So don't miss any of these sessions. I would request one and all. Thank you. Thank you, Dr.
Sure, thank you.
So friends, thank you so much for your introduction. I think only Dr. Ramya is left, and I've requested her to introduce whenever she's comfortable and she can have her camera on. Just a couple of technology reminders to all of you. First of all, please keep your video on. If you keep your video off, there's a possibility you can get disengaged. Don't mind my words. You will see the purpose why I ask you to keep your video on, because mind wanders. Mind wanders. And if your video is on, it's likely to keep you engaged in the program. So a humble request to all of you to keep your video on. You will never see me with my video off. Of course, if you are getting up, going somewhere, catching a glass of water or a cup of tea, that's different. But otherwise, please keep your video on and you will find it very, very useful. That's one thing. Keep your device on the mute mode. Only when you have to speak, unmute, and then please go back to the mute mode. Then stop video if needed. As I said, if you have to get up and get something for you, that at that moment you can have your video off. Also, whatever I ask, or if you want to say something, you can chat with me on personal window, or you can put the message on the group and we can all respond to you. And you can rename this thing, like the name that you actually officially have given me, because then we would be able to interact with you more effectively, because initially it will take me a little time to remember who is who, but then later on I'm sure I will remember. I don't need the name, but then I will know whom I'm talking to. Little bit about how we are, how I expect or how I request all of you to conduct yourself. I think one is, please speak for yourself and be mindful of others. Especially this is a mixed group. We have doctors, we have nurses, we have psychologists, we have quality implementers, we have people who are purely from the training background, and each one of us come with a great experience and expertise. If we are able to respect that, I'm sure we'll have a lot of rich learning beyond this program also. Only thing is we have to create that safe place for everyone to feel comfortable and share their thoughts and feelings. But when you are speaking, please be mindful of others and let there be nothing that hurt the other person or upsets the other person or demeans the other person. Then confidentiality of the program, because a lot of you will be coming up with your personal experience, with your personal life or at a professional setup, what you have witnessed or what you have gone through. So a request to all of you is, please, what is said here stays here. Do not go and quote, okay, that person was talking about that hospital, so this is what happens in that hospital. Or that person was talking about this doctor, so oh, this is what this doctor knows. And I know that doctor, I know his family. So please, that's not the idea. We are here to learn from each other's experience. Then engage, participate. See, my responsibility is to engage you, but equal responsibility lies with you to participate. And for that, ask questions. Ask n number of questions that are relevant. If I'm able to answer, I will answer. If the group volunteers to answer, they will answer. If we collectively are not able to answer, we'll park it and we'll come back to it once again, maybe in the next session or whenever possible, but we'll make sure that we address your question. But you must ask question. I think that's one way to, stay engaged. So everybody comes with an experience, and I can see a lot of you have 15 years, 20 years experience, a lot of experience. But at the same time, we are here to learn. So if I think I know more and I should be doing most of the speaking, probably others will not be able to share their experience or ask their experience. So let's be a little specific and brief when we are sharing our experience, and with the idea to be, very crystal with what we are saying. Feedbacks are very important. After every session, I will be giving you the feedback form. Be very honest, be very clear about whatever your takeaways or whatever your concerns are. I've left a column for remarks. You can write whatever you think you liked, you did not like. There is no worry that, okay, so and so Banu Rekha has written this for my program, so okay, why has she written? No. I will introspect and I'll definitely work on it and see how I can integrate that in my future. So trust is something that is earned and it will take time, but let's be open to the idea of, working together. So that's about the little bit of, the norms that I would request all of you to follow. Then very quickly, I want to share one Google link with all of you. That's just to see about our training, more like pre-training assessment thing. So I'll just share the link with all of you. Give me a second to get the link. Okay, there you go. I pasted the link in the chat box. If somebody could confirm it's functional, it's opening. Is it working?
Yes, ma'am, it's working.
Thank you. So after you have answered the questionnaire, please write done in the chat box so that I know how many of us have finished the questionnaire. Okay, Dr. Gaurang says it is not opening. So can someone post the link in the WhatsApp so that Dr. Gaurang can try once again? Let me see if I can post it, Dr. Gaurav, in the group. Yeah, Dr. Namrata has already done. Thank you, Namrata. So Pooja, this link is there on the WhatsApp. If you can go to your phone WhatsApp and open it, even that way.
Right.
Yeah. So 4 of you have done it, waiting for others to complete. So I've received 8 responses. 3 more to go. Okay, I think 10 of you have already done. 1 person is left. By the time you finish, now very quickly, if I may have everybody's attention, I'll just give you an overview of what this program is about and how we are going to do it so that you know what to expect from the program. See, any program has content and delivery part. If you will look at the course material that I have sent you, most of it is covered. It covers everything that goes into patient handling or team communication. But the major part of it is delivery of the same content. So this program is unique from the point of view that we are not only going to discuss the topics of healthcare communication, which are very specific, which you will get to see during the program, but we are going to focus a lot on the facilitation skills also. So when it comes to facilitation skills, I will be using different pedagogies during the training, which will be able to observe and identify that, okay, this is something different from what we do normally. Also, during the program, you all will be making presentation on different pedagogies. Of course, with my guidance and support to all of you, we'll be picking up different pedagogies which are new, which are interesting, which are engaging. And that will be, in a way, a very rich learning experience for all of us, because if we have 11 participants, you will get to see 11 different pedagogies. So you'll go back with learning different pedagogies from each other. Let me quickly share the screen with you just to tell you the topics that we are going to cover and how we are going to do it, so that we have clarity on what we are going to do. Okay, this is, I've received 11 responses. Okay. Can you see my screen? Okay, great. So if you look at the list of topics, the first session is, of course, introductory session. But in this session, we are going to very clearly understand what is the difference and similarity between the clinical communication and our day-to-day communication. And then what are the benefits of effective communication? We'll be discussing immediately after this introduction. The second session will be on developing communication competencies, where we'll be discussing about the verbal and non-verbal part, especially in context with the healthcare. Of course, many of you may be knowing the soft skill part, but it's not just about soft skill. It's about how do you go about building rapport with the patient to get all the information required to make a right diagnosis. All that we will be discussing in depth in the second session. So for many of you who are into training or who are in healthcare, probably you will say that we know it already. But just to bring everybody on the same page, we will have these two topics, but there will be a lot of new takeaway. Trust me, once we'll have the program, you will get to see this. Session 3 and 4 are specifically integrated in the program because it's a master trainer program. So I want everybody who does this program go back with the idea that I can design a successful training program. And then I know about the latest facilitation skills or the pedagogy or handling difficult audience, because I'm sure all of you must be facing this when you come back after the program where you could not engage or create interest, or you could not make them participate. So how do you go about doing it? We'll discuss in session 4. Session 5 onwards, it will be specifically patient and your team related communication. For example, managing patient expectations. So how do you understand patient expectation and why it is important to understand their expectation, and how do you meet and manage those expectations? Then a lot of us face situations where patients have complaints against the services or about the people. How do you go about managing and resolving those patients' complaints? We'll be having a session on it. Then we all handle people who are aggressive, who are not cooperative. And also in critical care areas, we know the emotions are very intense. It's very overwhelming for everyone. So how do you go about handling emotions of self and others, and especially handling aggressive patient party? Then handing over tools for doctors, for nurses, for different healthcare professionals. For some of you, it may be a topic that you have already talked about, but for some of us, it's going to be a new, protocol or new topic. For example, ISBAR tool, SBAR tool, iPass the baton. These tools we'll be discussing in handing over tools. We'll have a session on breaking bad news, especially when it comes to announcing death or some complication or deterioration in the condition. How do you go about doing it? We'll be talking about at length. And then disclosure of medical errors. Again, a very challenging topic. When you know an error has happened, how do you go about disclosing this to your patient or with the family? Something that you have to speak about, then what is the right way of doing it? All these topics are going to be covered through role plays, activities, questionnaire, discussion. Very few presentations, very short and crisp presentation, but most of it is going to be hands-on learning because it's more about learning by doing. So it's going to be very interesting, engaging, and also it requires your participation and interest in the program. Then from session 5 onwards, that managing patient expectation onward, two of you will be making presentation on one of the pedagogies. So I'll be sharing the list of pedagogies like storytelling, role plays, using demonstration, or using new techniques or new pedagogies to introduce your topic, like puzzles, riddles, quiz. And you will be making 15 minutes presentation. I will be there to help you, guide you, support you, and prepare your presentation. And from session 5 onwards, in a 2-hour session, I'll be taking session for 1 hour, 30 minutes. Last 30 minutes will be reserved for 2 participants to make their presentation. And simultaneously, we'll be covering these topics. So the requirement for the certification is attendance for all the sessions and presentation that you will be making. So this is in nutshell about the program. Any questions about it? Anything that you wish to ask or clarify or say? If nothing, it's all right. So just one more announcement. I know it is late evening, so in between, if you need a cup of tea, coffee, juice, please keep having. Look after yourself. I mean, you're open to have your tea, coffee while you're having your video on. Don't go and make it, but then get it on your table and you can have it, because I know after a long day you require to eat something or drink something to keep your energy up, so you feel comfortable and you can look after yourself. So any question about the pedagogy or the format or the of the program? Are you okay with it, or anything you need to add or say?
Ma'am, I had a question.
Please.
So these presentations, we'll get time to make it and come back, or do we do it while we are in the program?
No. After session 4, I will be putting I'll be sharing the Google link of the topics that you can choose. So each one of you will have to write your name and session number that you are going to, present. Or actually, from this time onwards, I think I will be giving you the session number with your name. You will have to choose the topic that you want to, because topic you can choose as per your comfort. But I think the session numbers I will decide right from the beginning. Unless you have a challenge, we will freeze that, because otherwise we have confusion about who's going to deliver in the next session. You will get, like for example, after session 4, you will have full 1 week to make your presentation. Much before that, you can speak to me over phone. I can explain you once again what I'm expecting you to do. And then you make a small, and presentation is just 4 or 5 slides. That's all. So how it is going to be? For example, you say, I will be talking about storytelling. Okay. So what I will expect you to do, you will be giving us a taste of storytelling. So you will share a story with us, maybe a minute or 2 minute story, not very long one. And then you will ask us, okay, what do you think I was trying to convey you through this story? So we will give our answers. Okay, maybe you wanted to talk about leadership, or you wanted to talk about motivation or team building, whatever that the message of that story is. Then maybe it's same to what you had thought, or if it is something different, you can say, okay, this story was about this. And then we move on to storytelling as a pedagogy. So what you have to tell, the 5 slides that you need to prepare. One is how to use storytelling. How to use storytelling to introduce a topic or to convey a message. Second, what are the advantages of using storytelling? What are the disadvantages of storytelling? What are the do's of storytelling? And what are the don'ts of storytelling? And where is the application area? Where all can we use storytelling in the program? 5-6 slides, that's all. So 15 minutes presentation. But much before that, you will be discussing with me, you will be sharing your slide with me. So in case if it requires any changes, we will discuss before that. and then you will be making the presentation.
Thank you. Sure.
Does that answer your question?
Yeah, sure. Thank you.
Thank you. Thank you. Okay, so moving ahead with the program, I think the next topic that we need to cover in this session is about understanding the importance, relevance of communication.
Hello, can you?
Dr. Ila, are you saying something? Please unmute. I'm sorry, I thought you were talking to somebody. Please unmute and say.
I had a question actually.
Yeah.
Yeah, so I'm not very sure, but I just wanted to check. So once we learn all these skills, whatever you will have to teach us and we will learn. So by any chance, are we going to cover the part this medical communication, which doctor does it with the patients? Okay, so any kind of evaluation, if I have to evaluate as a third party, that this doctor is talking to another doctor or a patient or a relation. So do we have any evaluation criteria or something of that kind where I need to evaluate if I have to evaluate?
So Dr. Ila, that's not in the scope of the program, but at the same time, if you require any tool that for evaluating the communication skills of doctors or nurses, you can always connect with me. I am available just a call away. That's all. You have to just message me. And if I have that tool with me, I'll definitely share with you that, okay, you can use this tool, or at least I can tell you what are the ways to, how to design a procedure. But whatever tools I have, I'll definitely be happy to share with all of you.
Sure.
The YouTube recording of all the sessions will be shared with you. It will be on the private YouTube mode, not on the public platform, but you can view it as many times as you want. That will be available to visit your system. Yeah, Dr. I think Pooja ji, you want to say something? Pooja, go ahead. Yeah.
Yeah, actually, ma'am, it was similar to what Dr. Ila was telling, because normally whenever their training program we are doing, after that there is an evaluation phase also. Like, we'll be getting a chance to know whether they have they have taken up whatever has been given to them. So that was very similar to her. I raised the hand by the time she asked the questions.
That's okay. So pre-training assessment, post-training assessment, I think as trainers, we must all learn to design our assessment tool. Whatever you are wanting to deliver, whatever you think they don't know or they don't know completely, if you have seen the questionnaire that you have answered just now, what I've tried to do, I've tried to see how many of you are well versed with organizing a training program comfortably, independently, successfully. And then I know that this is what I need to focus on. And I want to make sure that after 10 sessions, you can confidently say, I can design my program. That will be more like post-training assessment. But evaluating the communication skills of doctor, that's not in the program, but then I can, whatever tools I have, I will share with you. Like, for example, conducting training programs for the medical students. So that's not part of this program, but I'm doing it independently. Dr. Dipti is with me on that, and we are conducting this program. But if you wish to do something like this, if you want to understand the outline, I can share the outline with you, that this is how we are doing. You can plan your training. Idea is to help you become a trainer, independent trainer, not to become dependent on me, but to be able to independently design your training programs. So that's the objective of the program. Okay, so moving further from here and getting into the next topic, I want to understand from all of you, if I may ask you, first of all, is clinical communication different from the day-to-day communication that we do, or same? If anybody wants to say, please raise your hand, and then I'll request you to unmute your device. Okay, Dr. Dipti has raised her hand. Please go ahead, ma'am.
I feel that it is different.
Okay.
It is because it is a very focused thing. Number one, it is between unfamiliar people.
Mm-hmm.
And then time constraint is always there.
Mm-hmm.
And usually communication involves complex decision making. And often the agenda don't meet.
Absolutely.
Patient and our agenda are totally different. After, learning these words from you, yesterday and today itself, I faced two patients. One was one of our own fellows, and another one, and tough negotiations. And I don't think I had to bow down in front of their goal.
Wow.
Despite that, I couldn't enforce, I didn't enforce, I couldn't. I respected them. And have their way. I don't know how much I did. So I realized this is a different ball game.
Absolutely.
We
Absolutely.
speak Hindi or English or whatever language we do, but the content is different and mind game is different.
Absolutely. I completely agree with you, Dr. Dipti. Thank you. Dr. Ela, you wanted to say something. What do you feel?
Yeah, more or less I agree with Dr. Dipti. What I want to tell is the same thing, that the content is different for clinical and non-clinical communication. The principles of communication remains the same.
Yes.
That's what I want to just put it straight.
I completely agree.
If we learn the principles, that will be applicable to all the types of communication, wherever we go, with whoever we do. And I mean, that will work everywhere. So it's the content part which is different. So that means anyway, it's going to be different.
Absolutely. So what I would request everyone to come up with at least one thought. Either you find it, there are similarities also. Like Dr. Ela said, that the principles are similar, which I agree completely. Content is very different. Context is very different. This setup is very different. So if you can bring out something different from what others have spoken, not the same, come up with something very different, but at least come up with one point. I think Ritika has raised her hand, so I would request Ritika to share her thoughts. Yeah.
In a hospital setting, no, we're sharing very sensitive information about a patient's life. So when you're talking about something as serious as someone's life, when you're communicating about certain decisions that have to be taken about somebody's life, it's very different from our daily conversations that we have with friends and family. So it is a professional relationship. We don't have a rapport with them, and it's difficult to get them to trust us in the very first go. So it's a lot of information that has to be given to them, and we have to hope that they understand what they're saying also.
But you have talked about a lot of differences. So good. But you have talked about a lot of differences. Very true. It's a professional interaction. The communication needs are very high between the patients because they want to know, they want to understand. You have a lot of information to share, which is not like a regular communication. You're not talking about a story or a movie or a song, but it's very intense medical information that has to be communicated in a way that the person understands what you are saying. I absolutely agree with you, Ritika. You have shared a lot of points. Thank you so much. Dr. Monica, you want to say something? Go ahead. Yeah.
Yeah, ma'am. And I think the time of the communication also matters because the kind of state the patient comes to us, like what kind of mental state the patient is in, whether he's really depressed, whether he's ready to take the information or not. I think that is also important.
Absolutely, Monica. I think the basic difference, if we can remember, between the day-to-day communication and clinical communication is it is not a communication between two healthy people. It's a person who is well, healthy, trained, qualified, and it's a person who is unwell, who is seeking help, who is more like vulnerable at that point of time because that person is suffering. So their communication styles are going to be very different. Timings is going to be very different. The intention is going to be very different. I completely agree with you. Anybody else who would like to share their thoughts? Any similarity or difference? Even similarity would be fine. Because we are trying to understand what is the difference and similarity.
Madam, there is a point.
Yeah.
And one word is can explain the similarity as well as the difference.
Sure.
And that is trust. So the similarity is that in any communication, to make it successful, you do need a quantum of trust to be built on the information that is exchanged. Yes. That is a similarity. And that again is the difference because the degree of trust that is required between two strangers, and that you mentioned, one of a very high energy level and the other it has a lower energy level. The confidence and the need is very different. So it's a great energy divide between the two.
Absolutely.
The two are
absolutely energy divide, knowledge divide, and one more thing. In a relationship, probably is everybody between husband and wife, both needs to trust. In clinical communication, proactively, I need to win my patient's trust if I want compliance and if I want to hold the patient. It's a proactive effort from the healthcare provider's side to make sure that I am able to win my patient's trust. I think that's what we are not focusing on if you look at what is happening in the healthcare today. But that's a valid point. I completely agree. Anybody else who thinks of some similarity or difference?
Ma'am, I have to add a point.
Yes, please.
If I may, I feel between the two, I think elements of compassion also vary. And that makes a very striking difference between the two communications. Because to look beyond one's pain is pretty difficult. And again, the present state of mind in which the doctor is there, the state of mind in which the patient is there, and as said before, energy levels, situation, ambient environment, etc., etc. But above all, the basic element of having compassion within oneself makes a very large difference when it comes to delivering the dialogue. And the second point is monologues can be easily formed. And I believe most of the times with the rushing caseload that we have, it becomes a monologue. You ask patients, they answer, you write something and you dispense. But forming the dialogue is the key. I think once the patient feels that you will also listen to him, the communication varies. I think these are two things which I want to add.
I think I completely agree with you, and everybody will agree with you. Compassion again has to be demonstrated proactively if I want to win my patient's trust, if I want to hold my patient, if I want my patient to go satisfied. I completely agree with you. And listening skills that I demonstrate, and I don't make it a monologue. I rather go for a dialogue and make sure that the patient is able to share his or her thoughts in a manner that they're comfortable. And when they're speaking, I listen to them. I think that's very important, integrated part of the effective communication. And that's the need of the hour. I absolutely agree with you. Thank you. So Pooja, do you have a point to say? Please go ahead. Yeah.
Yeah, ma'am, it's more, completely agreeing with what Dr. Gaurang was just saying. It's actually, the patients who are there in the hospital, for clinicians, for nurses, for the people who are there in a hospital, they are like, they know every day these things. But for a patient who come there, it's a completely new and very different kind of atmosphere for them. So in order to empathize with them on the communication, it becomes utmost important, as you told, the proactive way. So because for them it's a tense situation, and they don't know the atmosphere. Even I interact with the nurses for the trainings normally for this, the cannulation and all these things. So for them it is just like putting a cannula every day. But for a patient who is coming in there, even that cannula itself, it makes a whole lot of difference. So explaining it to them properly,
painting that they're about to be, yeah.
Right. So explaining it to them about the effects, and again explaining it to them so that they can relate with that, they can empathize.
Different environment is different. It's a strange environment. Hospital setup is very strange. The smell, the equipments, other patients, and hustle bustle of any hospital department. It can be very overwhelming for a patient. Very, very overwhelming for a patient, and I completely agree. So proactively, can I make my patient comfortable? Can I make my patient speak? Can I win my patient's trust? So that means a lot of proactive efforts are required from healthcare providers if you want that communication to happen actually between you and your patient. So thank you so much. I think we had a wonderful discussion about, is it same or different? And I completely agree. A lot of things are similar. The principles of communication are same. You need to speak, you need to listen, you need to make it dialogue, you need to have patience, you need to have clarity of message. Absolutely right. But the context is very different, and that's the difference. It's not a communication between two equal people. There's a huge power and knowledge and energy differential. And proactively, I need to come down to my patient's level if I want to communicate effectively. Thank you. Next question to all of you. Why are we talking about communication now? Say 10, 15, 20 years ago, did anybody think that we will require a program like this, or will require trainers who will talk about communication training? What has happened in the last 2 decades, if I may ask you? Please raise your hand. Yes.
Yeah. I think, Madam, the relationship and the trust has suffered. in healthcare providers and healthcare seekers. Let's not simply say as between doctors and patients. I think today we have a set of healthcare providers and healthcare seekers. And also, if you look at it from a doctor to patient or a business to business, the trust relationship has suffered. It has globalization has its own effects. Competition has its own effects. And then the race to prove that, since I've seen the business part of it as well, in the hospitals in between and doctors, amongst themselves also, the fraternity. Somewhere the entire thing has landed upon a patient. The patient is confused today, like where to go and where not to.
Absolutely.
So
if I may request everyone to take one point, get one point, because I want everybody to contribute. And I'm glad that you all have an idea why are we needing to talk about communication now, because we talked about these classes earlier. So I think Dr. Shashikala rose her hand. Do you have something to add, Dr. Shashikala? Please unmute your device.
Yeah, the communication started becoming more directive, authoritative from the doctors rather than involving it in more. So many realized that it needs to be made aware of. Like just because they have a power of a knowledge, they went more authoritative, directing always what to do, what not to do, rather than having a patient's view in it. So some sensible people thought it needs change. That is when people started thinking about it. And
I completely agree with you. Earlier, it was more like, paternalistic style of, practice, where we as doctors decided on the patient's behalf, and patients are okay with the idea. They never objected to it. Whatever the doctor said was the last word, and everything was going well. But yes, a lot of things have changed in the last couple of years. That requires change in our approach, change in our way of communication. I agree. Namrata, you have something to say. Please go ahead. Yeah.
Yes, ma'am. Like, I would just like to add on to, like, as Dr. Virendra mentioned it very correctly, the commercialization. The commercialization is one of the major factor, and it has impact irrespective on public sector or private sector. Each and every sector has their own share of the pressures regarding to the customer satisfaction, engaging patients, the business targets, and everything. So to maintain all these things or to achieve a certain level of target, the communication is very important at all levels and all the departments in hospital. Because be it any department, the communication has to be with patients.
Absolutely.
So it's a patient-centric thing. So this is one of the major
I
things.
completely agree. Dr. Dipti, I think you wanted to say something about it.
Yeah, what I want to say is, at least in Indian context, the relationship was between people and a healer. And they won't question a healer. Healer is next. But that role is now dissolved. Doctors are nothing more than a service provider, just like an Amazon or anybody else. So they are equally answerable if the patient is not satisfied.
Yeah, I agree. I completely agree.
Relationship has changed.
Absolutely. The whole relationship has changed.
So they want doctors to be answerable even for their wrong choices. They want to be. I mean, patients expect moves as they expect from any sort of service, and that is why this thing comes in.
Especially when they are paying for it.
Very true. Why? Yes. Even in the non-paying person comes and says, "I'm paying taxes, and this is a government-even setup."
Absolutely, I agree. So, friends, Professor Dipti comes from a government setup, and it's a huge hospital, around 2,000 beds. Dr. Dipti, if I'm not wrong.
Yes, more than that. In fact, this was the largest hospital in the country.
Yeah, 2,000 announced beds. Usually, you will have doubling and tripling in many departments. So you can imagine around 4,000 to 5,000 patients every day in a hospital setup. And I think OPD of around 15,000 to 20,000 per day. So they have their own set of challenges, and we'll get to learn from each other how we are handling those challenges. Ritika, you have a point to say, and then I think Bhanureka wants to say something. And okay, Dr. Ela also.
I wanted to say that people are so aware these days. Okay, and yeah, it's not like before where whatever the doctor said was, God's word and it was followed blindly. Now everyone has seen the matter and they're very aware, and then there's the whole thing of litigations come into picture. So it's very, very important what we say and how we say, what we speak and how we convey to the relatives.
So like Dr. Monica has also written, Google uncle. Very true. You know, the Google uncle is very smart now. He's always available, and anybody and everybody goes to the Google, and and why should they not go? If there's a facility available, people will go. Whether you like it or not, they are going to go there. How I handle it is something I have to learn now. But I can't say why do people go to Google and I don't like it and I'm very unhappy about it. Yeah, Bhanureka, you had a point to say. Quickly, yeah. Bhanureka, are you there? I think her video has... Okay. Pooja, you have a point to add? Sorry, I think Bhanureka is back. Sorry, yeah. Bhanureka, are you back? I could not see any response, so I...
Yeah, yes, ma'am.
Yeah.
So that's what, since they pay us too much for hospitalization, they expect a very good command and communication from the healthcare providers. When you don't communicate properly, that will very well impact the commercial business of the institution also. So that's where the communication...
Value for money. Everybody wants value for money, and that's not wrong. Yes. That's not wrong. And I need to give justification to what I'm charging, and I'm accountable for that. I completely agree. Pooja, what is your take on it? Quickly.
Yeah, ma'am, absolutely. The thing is that other perspective that I wanted to add over here is from the hospital side. Like nurse to patient, doctor to patient relation is there, obviously, but there is something from the hospital side with the number of competitions which are there, no, that the brand perspective, like whether I get a referral to the hospital or not, they want to maintain that thing itself. So it is, in this context also, it has evolved a lot.
Absolutely. I don't know evolved or not, but yes, it's changed a lot, I can say. Okay, so I think Dr. Ela has a point to make, and then we move on to the presentation. Yes, Dr. Ela, go ahead. Yeah.
It's not easy for doctors also nowadays. Doctors' life is also so difficult. Actually, it's so difficult for them to become a doctor, first of all. There's so much of competition there itself. There's so much of payment to be done if at all they have to become a doctor. So the perspective of the doctor also has been changing, over a period of time. So this is the only point which I
think society on the whole is changing, and so is healthcare and medical profession, and we all need to get updated with the changes and be ready for the changes. People who are not ready to change are the ones who are going to suffer. So I think it's important to understand what is change and how do I really understand and deal with it. So let me quickly share the presentation with you. Can you all see the first slide? Okay, thank you. So we had a good discussion around it, and all of you agree to it that the practice of medicine was much simpler and easier earlier, as patients had a lot of faith in this profession. So never anybody had to make any effort to win the patient's trust or to show that I'm compassionate and caring for you. But today, I think patients have become very alert, and there are a lot of changes in the society. It's not just about the patients. There are a lot of changes in the society. For example, people have become more aware. They have access to Google. So they have an idea about what is the diagnosis, what is the possible diagnosis, what are the options available, and what drug has what side effect. Plus, when they are paying for this service, and even if they are not paying, like Dr. Dipti said, that in government setup, they come and say that the salary you are getting is from my, tax that I have paid. So they have expectations. They expect us to be answerable for what we do. We were never, I think healthcare was a subject which was never, answerable to anybody, but you can see in the last couple of decades, that's not the reality. We are answerable for everything we do or we don't do. Plus, I think overall aggression is on the rise, and it's not just among the patients, even among healthcare providers. I think aggression is on the rise. You will agree with me. Even we have become more stressed out and more aggressive. And one of the reasons why we have become aggressive is we do not look after ourselves. We don't eat properly, we don't sleep properly, we don't look after our health. And that makes us more vulnerable to aggressive action, reaction, and altercation with people. As a result, the hospital-patient conflict is on the rise. You may have seen a lot of news about the hospital being ransacked, or the doctors being beaten, or other healthcare providers being, experiencing aggression. And let me also tell you something. It's not just in India. Many of you may be wondering, it's India, the situation is bad. If you will Google search, you'll get to so 60 to 70% of healthcare professionals have experienced aggression and violence against them across the world. So it's not just localized to India, it's actually a global change that you will see. Plus, media participation is on the rise. We didn't have so many channels, we didn't have so many people reporting. Now everybody comes with their camera, they are recording your video and they post it on the social media and it goes viral. You don't require NDTV or ZTV or anything. YouTube is enough to viral your this thing, and then WhatsApp University is much above that. And we got to understand, and all this is really affecting. Even the problem of litigation is on the rise. In India, we don't have, still we don't have much of a problem. In Western countries, on an average, every doctor has 3 to 5 cases against them at any point of time. And each case takes around 5 to 6 years to get cleared. In India, things are not that bad, but I think on the other front, we are facing more challenges, that is extent of fights. Earlier, it used to be just verbal argument. It's no more verbal now. Very quickly, they, go down to manhandling the doctors, the nurses, or the other staff, or they start breaking the equipment and the furniture and damaging things. So things have really gone south side. And that's really worrisome. I've heard from so many, programs how the doctors or the nursing staff or the staff, security staff have been badly beaten by healthcare, by the attendants of the family, just because somebody did not talk to them properly or did not answer their request or did not understand what they wanted. So all these changes in the system brings us to a point where we need to understand that, is my communication with the patient okay? And if you will look into the root cause, in 80 to 90% of the litigation or violence or aggressive reactions, you will see communication failure as the root cause. And it's very important to understand what is actually existing. Studies suggest our communication with the patient is often inadequate. In its report on education in healthcare profession, Institute of Medicine, one of the very elite organizations known for research in healthcare communication and healthcare delivery, they have identified that clinicians and other healthcare professionals lack adequate communication skill training. And you will all agree with me, till a couple of years ago, we did not have any formal integration of communication skills with clinical training. Just recently, I think 2019, we came up with ATCOM module, that is Attitude, Ethics and Communication module, that has tried integrating these skills with the patient, with the students' clinical learning. And I think Dr. Dipti is one of the faculty on that. Am I right, Dr. Dipti? So are you working with the students?
I am working, no, I'm not directly involved with ADCOM,
okay,
but with the CBME rolling off since 2019.
Yes.
So the 2019 batch is now with us in clinical sites.
Yes.
And their learning skills involve communication, explaining, counseling. So these are integral part. And if the faculty is not familiar with this word, what will they teach? How will they implement? So that is my concern.
Wow. So are you finding any difference in the batches that have not been exposed to ATCOM and these batches? Do you see any change from your personal experience? Not to be quoted, please. Yeah.
I really can't say, because really the first batch has come now.
Yeah.
What I feel is like today only on the rounds, the 5, and it is luckily smaller batch. They seem bored. I don't know whether the change was in me, courtesy you, that I was taking them along throughout the rounds, or they are more involved. But I felt that maybe I will take a little time to actually tell you, reflect upon it.
Wow.
When patient, because 2019 batch after pre-para is coming to me now. Last year it was COVID. So only for past 1 month I'm having these batches. They seem to be involved, but let me see.
So good. I'm so happy that whether it is your effort or their learning, at least being familiar with the idea that these are the skills you require in patient handling. I'm hoping that in the time to come, things will change and we'll have, doctors who are already at least well versed with the idea of having these skills as an integrated part of their learning. So I would request all of you to read the next paragraph that I'm going to show you. Have a look at this slide. Yeah. What did you understand?
It said something about rusting and burning and use of oxygen.
Exactly.
It was fading away so fast.
Yeah, it went so fast.
And this is what exactly happens when you explain to your patients about their diagnosis, their treatment, or any procedure or intervention that you're planning. You know, a recent study by Teragini, 2019, found out that almost like, and it's not just this study, a lot of studies have shown that around 45 to 50% of the patients and the families, they say that they feel inadequate clarity on diagnosis. They feel the consultation was too rushed up. And they also feel that there's lack of involvement in deciding the treatment. Also, they are not clear about what is going to happen and what are the options available. And they are not involved in choosing what they are going to go for. So I'm just sharing these studies with you to help you see the present situation and why we need to work on the communication skills. Also, studies suggest that our communication does not meet the basic standards of informed decision making, as some clinicians feel that shared decision making is not appropriate in every issue. In contrast, there are some who advocate shared decision making and they argue that it is suitable in almost every situation. Just to share with you, I was taking a session for a group of anesthetists in LNJP, Dr. Dipti, that was in LNJP. So it was a group of senior residents. So one of the anesthetists said that, ma'am, in my OPD, I was, doing a PSC of a patient, and that was a young lady around 45 to 50 years of age, and she had to undergo foot amputation. She was high diabetic, and she needed foot amputation. And I was supposed to do PSC for that patient. In a very casual way, I asked, sorry, somebody has asked me, will you be sharing the PPT, ma'am? Sorry, Ila, I will not be sharing the PPT. The YouTube is recording is going to be with you. I would request all of you to develop your own PPTs. You have it in the recording, but develop your PPTs creatively. That will be the real, working on your content. If I give you something ready-made, you're going to talk what I talk. I want you to develop.
I was just looking for some of these links of these studies, which we can refer to.
So I will share the links with you. I will do that. Thank you. I'll do that. So I was taking this session, and then he said in his OPD, this lady around 45, 50 years age, she had to go foot amputation, and she was there for PSC. While examining her foot and otherwise in general examination, in a very casual way, he asked, from where are they going to amputate your foot? From which place? And that lady was completely shocked. She said, पैर काटेंगे? मुझे तो किसी ने भी नहीं बोला कि मेरे पैर कटना है. Imagine, you have decided that the lady has to undergo foot amputation, which is understandable. Maybe she actually had a necrosed foot and that needed an amputation. But you have taken such a big decision without informing your patient, without preparing her for it. If we are about to lose a small finger, which hardly plays any major role in life, if you have to undergo this actually, requires a lot of, processing. Okay, this has to go because this is going to cause septicemia, or I'm going to die because of it, or whatever the reason. You are going to amputate foot for a patient, which is going to completely change the lifestyle of the patient. And you have not worked on preparing and informing her. Of course, he would not have amputated without informing her, but what about preparing the patient, communicating, helping the patient understand that this is the only option to save your life? That's because either we are not good at it, or we don't know how to handle the emotions that are going to come as a response to it. So we cut the story short and we avoid the discussion about the options available and the pros and cons of each option. Studies also suggest that many of us look after the patient very well, but we do not consider the family to be the focus of our care. In the same study, 2019, I'm giving you Indian this thing because it's not just in Western world. These are the studies from the Indian setup. 32% of the patients indicated that the doctors did not straightforwardly address their questions and doubts. So we look after the patient, but when it comes to answering their concerns, addressing their concerns, we are kind of not very keen to do that. So with these facts in the background, I want to ask you, what are the benefits of learning communication from the patient's perspective, from healthcare providers' perspective, and from the organization perspective? Take a little time, write in the chat box, and then we will take these answers. What are the benefits of learning communication from the patient's point of view, from healthcare providers, and organization's point of view? How do you think patients are benefited? Or how are you going to be benefited as a healthcare provider? And how is organization? Wow, a lot of answers. Building trust. Yes, Dr. Monica, I agree. It's going to help you build trust with your patient. Patients feel, there will be better satisfaction, better compliance, lesser complaints. Absolutely, Dr. Dipti, I agree with you. From the patient's point of view, okay, Dr. Monica says compliance will increase. Absolutely. It helps to maintain good IPR with patients. Yes, Bhanureka, I agree with you. To understand and satisfy the needs of the clients. Yes, if you are able to communicate effectively, you will be able to understand their needs and satisfy them. Absolutely. Dr. Birender says patient's point of view increases compliance to the plan of care and so better outcome. Absolutely. For team, yes, better coordination, less loss of information during handover. Absolutely, I completely agree with you. Ritika, you have said rapport building, trust building, setting a strong foundation. They are the one that's going to have a long-term working together. Customer satisfaction. Yes, Bhanureka, I agreed with you. Pooja says better patient satisfaction. All of you are agreeing that yes, it will improve patient satisfaction if you are able to communicate. Yes. Good communication builds trust, results in patient satisfaction. And then yes, for the organization, less patient complaints, less litigation, less violence. I completely agree with you. Dr. Shashikala says patients will have overall experience of going through medical challenges with participatory. Yes, if you're able to make sure that you actually have them on board, definitely they are going to feel more as part of the team. Okay. Ila says patient satisfaction will increase, better patient experience, building trust. Dr. Peace. Yes, for doctor, it's peace of mind and better job satisfaction. Absolutely, I agree. For hospital, yes, it's going to be increase in the reliable patients and loyal patient. Absolutely, I agree. Dr. Shashikala says, yes, team will collaborate more. Yes, I completely agree. You will have, people who are ready to cooperate with each other with a more, positive mindset. For teams, it's going to reduce waste in reprocessing information and time management. Absolutely. If there's coordination, there's communication, a lot of lapses in the care can be looked after. It helps to avoid miscommunication within the team. Yes, you will see it just now. We'll do an interesting activity around it and you are going to love it. Then vision of the hospital can be achieved. Absolutely. Yes, if we align our way of working with the vision of the hospital, automatically you will be closer to your this thing. Lot of messages. Oh my goodness. For organization to achieve better brand value, trust and goodwill build. Wonderful. I think I will not go through all the answers, but I can see a lot of thought-provoking answers you all are giving. Absolutely. I completely agree. So let me quickly share with you. Actually, studies have shown that if you communicate effectively, their outcomes are also different. For example, multiple studies have demonstrated that patients who have more effective communication with their provider, they have better pain control and improved response to pain management modalities. They have also reported that they are able to effectively manage chronic conditions such as diabetes, cholesterol, high blood pressure, and HIV if we have good communication with the patient. Then there are improved outcomes with after surgery, and there is decrease in complications such as cardiac arrhythmia. This is in the cardiac conditions I'm talking about. And then, of course, improved cancer outcomes with regard to screening, survival, and suffering. These are all studies that have, shown. There are a number of other studies that have shown that if you have good communication with your provider, healthcare provider, your outcome actually changes. And that's a very big evidence to show that how effective communication can help you, improve your outcome. When you communicate well, there's no doubt patient satisfaction will go up, their compliance will go up, as one of you have said. They're more ready to listen to you, agree with you, and follow your instructions. Let me give you an activity. Suppose if a patient has to undergo a simple, blood investigation, just maybe CBC. Any idea how many people get involved in that activity? Can you calculate and write in the chat box? So all of you have guessed something like 4 to 5, 5 to 6, 5 to 7, 5, 10 approximately, at least 6, 6 to 7. Imagine for a simple activity like simple blood test, these many people get involved and that many opportunities for errors. Wrong name, wrong blood sample, wrong instructions, wrong ward, wrong unit. And you see this happening all across and I'm sure you all must be seeing this in your own setup. From the healthcare provider's point of view, good communication leads to better coordination and less errors. On an average, in a stay of 3 to 4 days, patients' information exchanges around, guess how many hands? How many hands? Yes. How many hands, Dr. Binder? More than 20? 50? Yes. Almost like 50 to 60 hands. And that many opportunities of error. Look at it from that point of view. If you are able to make sure that there's a continuity of communication, there's clarity of communication, you can ensure continuity of care and ensure patient safety. Then, of course, there is reduced friction in day-to-day functioning if we communicate well with our team. If doctors, nurses, front desk staff, billing staff, back-end staff in the kitchen, in the laundry, in CSSD, if they communicate well, of course, your communication will be frictionless. It will also reduce conflicts with your staff, patients, and their family members. Automatically, the errors also would go down. Do you know that according to Joint Commission International, medical errors are the third commonest cause of deaths. Third commonest cause of deaths. Patients don't die of COPD, suicide, firearms as much they die because of the medical errors. In US, we haven't done any study in our country. I don't know if we do, where we will stand. You can tell me better what it will be like. Medical errors like wrong side surgery, wrong medication, wrong organ removal, wrong treatment, wrong patient are very common. 1 is to 33,000 errors. One error in aviation industry would happen when we have 33,000 errors happening in healthcare. According to Professor Ashish Jha from Harvard University, approximately 5.2 million medical errors happen annually in India. And I think it is underestimation. And you will agree with me. Most of these errors are around medication error and patient care and surgical errors. 60 to 70% of these errors are because of poor communication. And most of these medical errors are not because of patient. It's because of internal communication failure. Let's do a small activity. And if you communicate effectively, I think these errors can be comfortably looked after. So what I'm going to do, I'm going to put 5 of you to the waiting area, and I'll be calling you one by one. Is that okay? And I'm not going to pick anybody. It's just, randomly whoever name comes in the list on top. So Dr. Dipti, your name is first, so I'm putting you in the waiting area, and I'll take you back. Give me a second. Where do I? Okay, put in the waiting room. Fine. Next is Dr. Birender. Again, I'm putting you in the waiting area. I'll call you back. Third is Banureka. Okay. And then Namrata. I'm putting you in the waiting area. 4 people have gone in, and then 1 more person. 5. Ritika, you are also going. Okay. I'll call you back. Done. Okay. So 5 people have gone in the. Okay. So how many people are there now? Only 4 of us? Others are on the right. Okay. So I am going to, I need 1 person from all of you. Maybe I'll ask Ela. Ela, is that okay? So I'll be showing you a slide. You have to read that slide. Others also will be able to see and read it, but do it quietly. Once you have done it, then let me know and I will start with the activity. Okay. Can you see the slide? Let me know when you're ready.
Yeah, I'm done.
Okay, great. Okay, so I'm going to stop sharing this slide with you now. So I'm going to bring one of the participants from the waiting area. Is there some challenge? I think Monica is not there. There's a message in the group. Oh, network issue. Okay, so Ila, I'm going to get one of them from the waiting area. Whatever you have understood, seeing that slide, you have to communicate that to the next person. So let me bring that person in. So I bring in, who are not there? Okay. So I'm bringing in Monica. So Monica is joining in. Dr. Dipti is saying can't join. I need to message her. Can somebody message in the group that we will take you one by one? So Monica, are you there? Monica, are you there? Okay.
There was some network issue. I think the call got disconnected.
Okay, no problem. So Dr. Ela has a set of information. She's going to share with you. Please listen to her carefully.
Yeah. So Dr. Monica, what I want to tell you is there is one patient who is a 65-year-old male. His name is Ram, and he was suffering from tuberculosis, pulmonary tuberculosis. And he is already there in the hospital ICU since last 5 days. And he spent 5 lakhs of rupees, till now. So his son is very much worried about that. And he's the only breadwinner of the family. And with the same regard, he wants to speak to the doctor. So this is the information I have.
Thank you, Dr. Ela. Thank you. So Dr. Monica, have you understood? Dr. Monica, have you understood?
I think she's freezed.
I think there's some challenge at her end. So maybe I think I'll take another person.
I'm really sorry, ma'am. I was not in.
Sorry, Monica, I think
Please, ma'am, repeat the question. Actually, I was not there.
So Monica, maybe what
There
you
was
can
some issue with the network.
you close your video, audio quality will improve. You can close your video stop your video for a while. So Dr. Ila, go ahead.
Can you just repeat?
Dr. Ila, please go ahead. Please repeat.
So are you able to hear us now? Are you able to hear me?
Yeah.
Okay.
Yeah,
So
yeah,
okay. So the information which I have is there is one patient whose name is Ram. He's 65-year-old male and he was admitted in the hospital ICU with pulmonary tuberculosis. And he has already spent 5 lakhs of rupees for this treatment of this illness. And his son is the only breadwinner of the family and he's worried about this now. So he would like to speak to the doctor with regards to the same.
So, what I would suggest, since your audio quality is not okay, you just be observer and let me take somebody else in, and then Dr. Ila can explain to that person, and you can watch the activity. Don't worry, just watch the activity. Is that okay?
Sure, ma'am. Sure. Actually, I'm not able to understand like what should be my feedback. Should I take? I mean, am I supposed to give my feedback on the patient's?
No, just observe. No, just observe.
Or am I supposed to be on the
mute your video. Monica, please mute your audio.
I was not initially. I think I was not in the group when this activity was being discussed. Okay.
So Monica, please mute your audio. Mute your audio. Okay. So Dr. Ila, I am admitting Ritika. Please explain to Ritika. So let Ritika come in. Let me explain to her. And then you explain whatever you have to explain. Ritika, are you there? Can you have your camera on? Okay. So Ritika, Dr. Ila has a set of information she's going to share with you. Please listen to her carefully. Dr. Ila, go ahead, please.
Okay. So Ritika, there is a patient whose name is Ram. He's 65-year-old male. He's admitted in the ICU since last 5 days. And he's admitted with pulmonary tuberculosis. And he's already spent 5 lakhs of rupees for his illness, the treatment part. And he has one son who is the breadwinner of the family, only breadwinner of the family. And he's worried about that. And he now wants to speak to the doctor with regards to the same.
Okay, Ritika, I am admitting the next person. Whatever you have understood from Dr. Ila, you are going to explain that in your words to the next person. And that's Dr. Dipti Goswami who is joining us. Okay. Now, Dr. Ila, you will not be saying anything. It's only Ritika who will be, okay. Dr. Dipti, are you there? Dr. Dipti, are you there? Okay, so we had put you deliberately in the waiting room. You were not stuck, Dr. Dipti. So Dr. Dipti, Ritika has a set of information she's going to share with you. Please listen to her carefully. Ritika, go ahead, please.
Dr. Dipti, there's one patient. His name is Ram. He's 65 years old. He's admitted in the ICU, and his illness is that of pulmonary tuberculosis. And he has one son who's the sole breadwinner of the family, and he is very worried about his father's illness.
Okay, Dr. Dipti, is that okay? Unmute your device.
Yeah, I'm fine. Okay. I didn't know it's
okay. So I'm
some connection problem. My concern is some connection problem that
lot of the participants are having this challenge.
I had to add one more thing. Sorry, if I may.
Okay, go ahead.
That it was for 5 days and 5 lakhs was the costs already so far.
Okay, so I'm admitting Namrata. So Dr. Dipti, whatever you have understood, you have to explain to Namrata. Yeah. Whatever you have understood from Ritika, that you have to explain to Namrata.
I have to do?
Yeah, 1 second. Let me first tell Namrata. Namrata, Dr. Dipti has a set of information she's going to share with you. Please listen to her carefully. Dr. Dipti, please go ahead.
What am I supposed to do? I think the audio was getting interrupted in between when when Ritika was saying something.
Ritika had shared a set of information with you.
I couldn't get it completely because of some audio problems or something.
No problem. Okay. So Ritika, whatever you remember, please share with Namrata now. It's okay, Dr. Dipti. Fine. Don't worry.
Okay. Namrata, there is a patient. His name is Ram. He's admitted in the ICU since 5 days. His bill is already 5 lakhs. And the illness that he has is pulmonary tuberculosis. He's 65 years old and his son is the sole breadwinner and he's worried about his father's condition.
Okay.
Okay. So Dr. Now Namrata, I'm admitting the next person. So whatever you have understood, you have to explain to the next person.
Right.
So Dr. Virendra is joining. So whatever you have understood, you need to now explain to Dr. Virendra. So let me get him in. Yeah. So Dr. Virendra, Namrata has a set of information she's going to share with you. Please listen to her carefully.
Yeah, Dr. Virender, it's about there's one patient named Ram who is admitted in ICU since 5 days and he is having pulmonary tuberculosis and he has almost spent rupees 5 lakh in his treatment and his son is the only sole earner in his family. Yeah, that's all.
Thank you. Thank you, Namrata. So, Dr. Whatever you have understood, you need to now explain to the next person, that is Bhanureka. She is joining in. So, you have to explain in Bhanureka. Okay. Bhanureka, Dr. Virendra has a information he's going to share with you. Please listen carefully. Go ahead, please.
Yeah, so there is a patient who is admitted in the ICU. He has spent nearly 5 lakhs on his treatment. He is in poor condition and there is pulmonary edema and tuberculosis detected. He has a son who is taking care and paying for the patient and the only sole breadwinner and guardian for the patient. Thank you.
Thank you. So, Dr. Bhanureka, what did you understand?
So he said a patient has been admitted and he's been in ICU for since 5 years and he's having pulmonary edema and all those complications and the son is the only breadwinner of the family and his hospitalization bill has almost reached about 5 lakhs.
Thank you, Bhanureka. So what happened, friends? If I may ask everyone to have their camera on so that I know you have heard, because those of you who were there from the beginning, I think Pooja was there, Dr. Shashikala was there. Who all were there? Ila was there. Okay. Kya hua, Pooja? What happened to the information?
Ma'am, the information got because the sole reason was the son wanted to meet the doctor. I was mentioned in the end. So by the end, we could only get what is the situation, but the purpose, we missed it in the...
Exactly. Dr. Shashikala, unmute your device.
Patient's name was missed at the end. and between Ritika could remember again and put 5 lakhs. Otherwise, she had already almost missed that. Yeah, that was the...
Dr. Ila, what happened? What is your observation?
The observation is the more number of transaction happens, the chances of miscommunication, loss of communication is going to be there.
Exactly. So imagine this small activity that I did with you, which was very simple information. There was no technical information. But could you see how the whole information got distorted? I'm sure others want to know what was the information, what was the complete information. So let me quickly show you this slide and then move forward. The idea of doing this activity with all of you is to help you see how even a simple set of information can get distorted. We can lose some information, we can add something to it, and the whole message can get lost in the process. Now imagine, I said, in a 3 to 4 days of stay, patient's information exchanges 50 to 60 hands. You know, handing over in healthcare is considered Bermuda Triangle of healthcare. And I think you can very well imagine how the whole information gets lost. The purpose of this information was, in the end, the message was that you have to meet the doctor.
Yeah.
But the whole message got completely lost. And this is a very common thing you will see happening, you know, across healthcare professionals, especially when there are so many barriers. Language can be a barrier, hierarchy can be a barrier, speed of speaking can be a barrier, listening can be a barrier, being preoccupied can be a barrier. And this is something, I mean, there are n number of barriers. Unless you're really very focused on it, you can actually compromise patient safety in that process. I remember I was taking a session for a group of neurologists. So he said, I had a pediatric, case for, who had seizures, and I had put that child on convulsants. So it was, syrup, what was that? Syrup Eptoin. So he said, the patient's father came in the next visit and he said, कि डॉक्टर साहब कितनी शीशियां लेनी है? He said, कितनी शीशियां लेनी है मतलब क्या है? I didn't get you. He said, आपने लिखा है ना, ये दवाई 100 ml सुबह और 100 ml शाम को. It was 100 mg, and by chance he wrote ml. I remember in my clinic, my husband is an ophthalmologist, so we have a joint clinic. So in his clinic, he wrote for a patient everything, and in the end he said, eye care as advised. Clean the eye care as advised. The chemist gave a medicine in that place also. I'm just giving you these examples to tell you how lapses in communication can be very dangerous. When we write medicines like simple eye drops with steroids, and patients feel relief, and they don't know that if we continue taking, it can lead to glaucoma or cataract, patient safety gets compromised. So it's communication not just with the patient, but between us also. That's very important. Better communication also reduces the risk of medical negligence allegation. You know, studies have shown that most important factor in people's decision to file lawsuit is not negligence, but ineffective communication. Actually, in 71% of the cases, it was found that legal claim for medical negligence actually had poor communication in the background. And that shows the importance of effective communication, especially in cases where there have been, like for example, breaking of bad news, end of life care, grief counseling, there are very intense communication. Unless you know how to communicate, unless you know how to handle situation, you would usually fail to be effectively handling the situation. And these things usually end up in violence and aggressive reaction, or people going for litigation or defaming you. And the worst is, now they go on the social media and write poorly about you. In another study, 79% of the patients and 68% of the families said the bad news encounter was suboptimal. Physician was too blunt, or they said place of time was inappropriate, or the patient got the sense that there was no hope, or they wanted the physician to balance sensitivity with honesty. So that means somewhere either they were too blunt, too harsh, did not give time, did not express compassion, care, concern, trust, did not care to do that. These communications require advanced level of training. I don't think we have anything of this sort. And most of these situations end up into violence. You can actually prevent violence if you can regularly update the patient's family about the condition, keep them in the loop by informing them, and also discussing the options available. and then letting them see the patient so that they know the condition by observing the patient. And then, of course, answering their questions, addressing their concerns, including financial concern, which we are very unwilling to talk. And all that can actually reduce the risk of violence in workplace. If you're able to do all that, automatically your professional satisfaction goes up. You are happy, you enjoy your life, you enjoy your work. There's no end to the satisfaction. For the institution, I think very important is patient's experience scores goes up if the patients are served well. Obviously, the institutions are viewed, oh, go to this place, you'll be happy. Or don't go there, they're useless, or they're cheat, or they're greedy, or they make fool of you. Good communication environment at a workplace creates a good work environment. People are happy, they communicate well, they respect each other, they talk to each other properly, they deal with patients and their family member with respect. So automatically the work environment is very different. There's job satisfaction for the employees. We always talk of stakeholders. I think employees are our first stakeholders. And training and retaining the employee is one of the very important responsibility we all have to take. But that will only happen if we know how to create job satisfaction. Patient loyalty. Patient would not go anywhere if they're satisfied with the way you and your team communicates with them. Of course, they're likely to recommend. 75% of the patient's footfall comes from the word of mouth your patients spread about your organization. Even if you don't put big hoardings and you don't advertise anywhere, but if your patients go satisfied, they're going to send you chain of patients. And then, of course, the enhanced safety and quality automatically will improve the image of the hospital everywhere and anywhere. So in nutshell, I think the purpose of this session was to help you appreciate that clinical communication is not just about niceties. Yes, they are part of it, but that's not niceties. A lot of time this becomes a hurdle when you conduct a training program, especially for doctors and senior consultants. They will say, we know all this, why the hell do I need to know this? No, clinical communication is therapeutic communication that happens between you and your patient. So you need to know what is the right way of communicating. It can ensure your diagnostic and treatment accuracy. It can earn you patient compliance. It can ensure patient safety. Then it's the clinical communication between team members, between the healthcare providers, again, to prevent lapses in care and ensure continuity of care. It's part and parcel of the overall treatment and is not optional. You can't say that I will treat, but I will not communicate. And it has a direct impact on the continuity of care, patient safety, and treatment outcome. I think the whole purpose of any organization. And there are set communication protocols that every healthcare professional must know and practice them. And there are multiple ways to learn and implement these skills. And I think this is what we are doing through this program. So those of you who are directly involved in patient care will definitely be able to use these skills right from your to your workplace. Those of you who are training, again, you would now know whenever you are planning a program, most important is to help your audience see what is the importance and relevance of communication and how it is similar and different than regular communication. And those who are in administrative positions or management positions, now you know why I need to sensitize all my staff to the understanding that clinical communication is not just about niceties. It's important to ensure patient safety, continuity of care, and better health outcomes. And you have seen through a number of studies that this is already evidence-based. So with this, we come to the end of this particular session, the introduction part and the first part, because this is something like baseline I have laid. Any questions about this, whatever we have discussed till now?
No, yes. I just want to add one more thing. Sure. JCI included communication as the basic thing. When they observed, there are a lot of sentinel events which happen because of the lack of communication. That is why even NABH or JCI wants communication or any soft skill to be given emphasis so that we can reduce sentinel events, which are unexpected events like patient dropping or giving wrong medication, whatever you have mentioned. So just I wanted to add that one.
Thank you so much, Dr. Shashikala. I think both your points are very well, very valid. I just want to add two things to what you said. One, JCI, NABH talk about communication, and I know PRE 8E talks about communication, patients' rights and education. But very honestly, it's not about they asking for it. It is we implementing it in the real sense. How much of it is really genuinely being implemented, because it requires a lot of training, lot of sensitization, lot of preparation of the staff to understand that we cannot afford not to communicate. And communication failure can actually lead to very serious outcomes. So you're very right, sentinel events are actually the result of poor communication, a lot of them. And therefore, that has to become part of the evaluation, but then there has to be training, and it doesn't have to be just on paper, but in reality, actually, it should come in the practice. I completely agree with you. Thank you. Dr. Monica, you have something to say. Please go ahead. Yeah.
Yeah, like I have worked on the administrative profile also. So what I have seen is sometimes what happens, there has to be like a responsibility, like I don't know, maybe the director or somebody, the owner of the hospital, they should decide that who has to communicate what. Because in my personal experience, I saw that many a times the patient relatives and the patient himself was informed something else by the nurse, and then they would go to the doctor and then they tell us कि डॉक्टर ने तो ये नर्स ने तो ये बताया, आप कुछ और बता रहे हो. So that thing also is a major factor. What I have seen, I have experienced myself. So I think that designating somebody who has to communicate and who doesn't have to communicate, that should also be very clear.
So Dr. Monica, actually, I could not listen and understand to your statements because there's a lot of, voice disturbance. And actually, I would request each one of you to ensure that you have good Wi-Fi. And you can see it's all participatory. If you're not able to communicate well, you will not be able to participate well. And your learning will get impeded. And then also, we will miss the information that you wish to share with us. So humble request to all of you to make sure that you have good Wi-Fi so that whatever you say, we can listen to you. I did get that.
Can you hear me now?
Dr. Monica, yes, you want to say something?
Can you hear me now?
Actually, there's a lot of fluctuation, and even the speed actually becomes sometimes slow and sometimes fast. It's probably because of the internet. Probably because of
Okay, so can you hear me now?
Yeah, try. You can try if you want.
Yeah. So what I was saying, ma'am, that sometimes what happens is that, there is communication from the side of the nurses and the other, caretakers also. So there is confusion in the patient's mind and the relatives also, that sometimes what happens ki nurses kuch bata dete hain, and then the relatives and the patient goes to the doctor ki nurse ne ye bataya. So that confusion, creates more problems, I think, for the doctor who has to do the actual treatment.
So that way, in every setup, you will have to see where communication failure is happening or lapses are happening, and how do you really make sure that these are stitched so well that there are no lapses. Okay. I completely agree. I'm sure that must be a problem that you are facing in your setup. Thank you so much. Any other question or statement anybody wants to give? So if there are no questions, and
just one point.
Yes, Dr. Birendra, go ahead. Yeah.
You know what? In the beginning, that you asked the purpose of coming to the program. So I think as we end now, definitely want to implement this, and this entire it's like a revolution. This is something that wasn't existing, and it was there in a way, like everybody thought they knew to communicate. So
that's the biggest hurdle,
And sometimes you become immune when you think like that. You are not, you will not be able to learn further. So the question that I have is, or rather the purpose, would like to really implement this for doctors and nurses and all the staff members, and looking forward to developing some of our own contents through our experiences and tools and the pedagogies as you will go ahead and train us. And I wonder sometimes that are 10 sessions enough for it? It's just a question.
Dr. I'll tell you one thing. Since you're asking, this is a very interesting and important point. The 10 sessions will lay the. Yeah, you want to say something more?
Yeah, what I meant by 10 sessions was, can we continue on our own reading about it, how to direct ourselves on this? Because, you know, the course that we have now, or the training, how can we continue educating ourselves on this is also something I want to ask.
I will. Thank you. Thank you. That's a good question. So, see, these 10 sessions will lay the foundation for all of you. It will lay a foundation for all of you, at least your understanding about the importance of communication and the important topics that you need to integrate in your training program. And then how do you integrate? Because my focus is on how also. These three things I assure you will be looked after in the program. I've given you the content. Sent you the course material. It's around 70-80 pages material. I will request each one of you to, go through that content and be ready with this thing. Second thing I can recommend is, this is a recent book that I have published. That's Fundamentals of Clinical Communication. And Dr. Dipti has done a lot of hard work with me for reading the content, my first drafts, and giving me her feedback. I mean, she has been through and through. I'm very sorry I could not have her name here. I wish her name was there. But the kind of effort she has done with me, it's almost like she could have been my co-author. Every time I wrote a chapter, I emailed to her. I said, you give your review point. I would request all of you to read this book. Fortunately, the book has been priced at a very nominal charges, just 300 rupees. And it's available on Amazon. Chapter 7, 8, 9, especially communicating with different population, like elderly, pediatrics, chronic disease, people with visual deficit, auditory deficit. It's a beautiful, I mean, we have written all in Indian context. I didn't try to copy from what others have written. I thought what will be applicable in our country. Second is handling difficult clients. That's also challenging. Sometimes patients are very demanding, anxious, clinging. I'm unique and treat me first. How do you handle with them? Even that has been dealt very well. And third, intense communications like end of life, breaking bad news, disclosure of medical error. Again, they are all there in this chapter book. If possible, get hold of this book, start reading. I think it's just the beginning. When I started, the moment I used to start the program, people were disinterested. We don't want to know clinical communication. We know everything about it. But when I ended my session, I mean, they would say, this was something I did not know. And these 15 years or 10 years have given me beautiful, experiences in this field. And this has become my passion now. I breathe this, I sleep this, I eat this, I do everything with this. My 18 hours go into this, thinking, working. And this program also have evolved on my own. Nobody has told me, nobody has asked me. I just thought this is what I want to offer my fraternity. Create clones in your own organizations. Have more and more people who have undergone this program. Ask them to do training. What I'm saying, Ritika, in your hospital, your Dr. Mehul had probably, what is his name, Dr. Mehul. I said, get 10 of your, professionals trained by me. 3 doctors, 3 nurses, 3 administrators, and somebody from the senior position, 10 people. Now you have a team of 10 people who can do trainings for you. In case 1 or 2 will leave, induct 2, 3 more. You will not have to work. You can get this implemented. And pick people who are your champions. Don't pick people who are not interested. This is a, work of labor, work of passion. If people are not interested, they will not like it. But who are interested, they will sit like you from 8 to 10, 30, not 10, 10, 30. I know
waited for the organization to do it, and then there takes a lot of approvals, I believe, to get them to sponsor so many people. So I just decided I'm going ahead because I don't know when that will come. So I finally.
And all of you have come with the leap of faith that you like this subject, but you don't know much and you want to get trained. I think I know the passion that's driving you to be here with me. especially like people like Pooja, who enrolled on the last day when I had already said the registrations are closed. Dr. Birender also enrolled, and that also, they have paid for the program, but due to some reason they could not join this batch. And they said, "Ma'am, money back, please take us in the next batch. There's a reason we can't take." So I could take both of you. I said, now we have a place. So very quickly, I'll share the feedback form with you. Don't hesitate writing your feedback, whatever comes to your mind, whatever is your this thing, so that we learn from what are we going to really, do or in our next session. And I always make sure that we customize the program as per my audience. In the last batch I had a lot of CEOs of the hospital, so they wanted a lot more than the training program, and I tried bringing that in the program. Similarly, whatever thoughts you have or you think you want to be covered, I'll try my level best to bring it with you. Give me 1 second. Yeah, the feedback form I want you to. Yeah, feedback form. Any other question or point that you want to ask or say?
Ma'am, for
yeah, please go ahead.
Yeah, for these the evidences that we discussed. So please share those links, because we just want to go through that in depth.
I will do that. I will do that right away. And if you will have a look at the book, even this has given all the references in the end of every wherever they are mentioned.
Sure.
Yeah. Okay. So I'm sharing the link for the feedback. It's a very short, very simple feedback that I've kept. So I'll end the recording on the YouTube.